My name is David Deyhimy. I am a board-certified addiction medicine doctor, as well as a board-certified anesthesiologist, and I'm the acting medical director of the EDGE Treatment Center. Yeah, I probably started thinking about careers in medicine as a teenager. I ended up in the ER quite a few times, and I was by accident, but I became increasingly interested in the human body. During this period, my late teenage years, I moved to Europe for a year to go to school and to race bikes, and trying to figure out whether I was going to try to be a professional cyclist or whether I was going to go to college. And that year was very pivotal for me because I concluded rather decisively that I don't want to be a pro cyclist. I mean, doping was absolutely part of what it meant to be a pro. And so when I returned to the United States, I was like 17. I was pretty committed to going to college for sure. I've always sort of been into physiology and how the body works, and this is basically probably precursors to me ending up in medicine. When I was in college, I had 1 year in particular that was very rough, where I myself became very depressed. And I knew that we had depression in my family because my mom had been suffered from depression on and off again. And one of the doctors gave her a lot of pills that all at once, a large supply of amitriptyline. And I think, yeah, one day she just went and took it all. So. I didn't understand that depression is like a medical condition, and there are effective things that you can do to help yourself, and it probably re-sparked my interest to want to maybe go more the medical route rather than the sort of studying of science route, because I could potentially have more of a direct impact on people in a meaningful way. But it changed my perspective a lot on mental health and depression. Part of what I do and become is going to basically be helping people not have to suffer like that. After my period of depression, I became pre-med again. Even though I was still doing psychology, I started taking all the pre-medical school classes, and had a real purpose as to what I wanted to do. I couldn't imagine anywhere else in the world that I'd want to be than having this opportunity to get to go through this process with this group of people that became some of my best friends ever, while we go along together learning how to help and save people. That was the coolest thing ever. Yeah, I love medicine. It's sort of endless, the things that you can go and look into and learn and then apply to people.
Is there anything that really kind of heightened your compassion for people with addiction disorders, or?
Well, yeah, I mean, in particular, people with addiction disorders have mental health disorders, right? So addiction and mental health are not separate things. They're very, very much overlapping. 50% of people that, easily, 50% of people that have form an addiction to a drug or alcohol have an underlying mental health condition. So what's happening is people are often self-medicating because their mental health condition isn't being properly treated. At the end of the day, why addiction medicine is compelling is because the medications that we use combined with good behavioral treatments have success rates that are as good, if not better, than a lot of other medical conditions. There's also this misunderstanding, this sort of idea that it's hopeless. That is what a lot of parents think, that is what a lot of patients think, and it's anything but hopeless. You just need to be fully educated on what the treatment options are, and you have to be somebody who really wants to get better, who's motivated. One of the things that I love about practicing this is just getting to educate the patients, the families, because if we're going to change this sort of narrative on addiction, we have to destigmatize it. And the way we destigmatize it and change attitudes towards it is through knowledge and education, and having people understand that this is a disease. It's not a moral failing. It's a chronic relapsing disease of the brain that shares features in common with other chronic diseases, and there are very, very effective treatments. And so I enjoy that part just as much as treating the patients.